Today's lesson we are going to be discussing substance abuse and tobacco. This is based off of Activity 17, Tobacco Death List from Glencoe Hands-on Health Creative Teaching Strategies. Our lesson objectives today are to recognize and identify dangerous chemicals in tobacco products, to gain knowledge of how these chemicals affect the human body, and to understand the threat that tobacco has on human health. For our first objective, we are going to be discussing dangerous chemicals found in tobacco products. These chemicals include formaldehyde, propylene glycol, cyanide, arsenic, plutonium-20, toluene, cadmium, and benzene. For our second objective, we are going to be discussing how these chemicals impact our health. Formaldehyde is a known carcinogen, and its exposure can cause nasal and eye irritation and an increased risk of asthma. Exposure to propylene glycol can cause an increased acidity to the body, and it is a potential skin irritant. Exposure to cyanide at high levels can cause coma and death, breathing difficulties including shortness of breath, and chest pain. Exposure to arsenic can cause sore throat and irritated lungs, nausea and vomiting, and decreased production of red and white blood cells. Exposure to plutonium-20 can cause cancer over long periods of time, and some of these cancers include lung, bone, and liver. Toluene exposure can cause tiredness and weakening, nausea and loss of appetite, and confusion and memory loss. Benzene exposure can have negative effects on blood, including a decrease in red blood cells. Exposure to benzene can also be harmful to bone marrow and decrease immune function. Cadmium exposure can cause severe damage to lungs through inhalation. Cadmium is also known to build up in the kidneys, which can cause kidney disease, and long-term exposure to this chemical can lead to fragile bones. For our third objective, we are going to be discussing health statistics related to tobacco use. The tobacco industry spends billions annually marketing cigarettes. As of 2018, nearly 14 out of 100 adults currently smoke cigarettes. This is nearly 13% of the US. Smoking tobacco is the leading cause of preventable death and disease in the US. Tobacco use accounts for more than 480,000 deaths per year. This is about 1 in 5 deaths. Smoking has declined about 7% in the US since 2005. The top 3 states with the highest amount of adult smokers are West Virginia, Louisiana, and Kentucky with over 20%. Smokers die an average of 10 years earlier due to tobacco use. On the left, I've created a table for cigarette smoking and age. On the left column, I've created 4 age ranges, and on the right, I've listed the percentage of adult smokers that corresponds to that age range. For the last part of this lesson, I will be asking a couple questions regarding the information from the lesson plan. I will ask you the question, give you a couple seconds to come up with an answer, and then give you the final answer. Question 1. What range of years has the highest percentage of cigarette smokers? The answer is 25 to 44 years with about 16.5%. Question 2. Which chemical found in tobacco is associated with tiredness, weakening, nausea, loss of appetite, confusion, and memory loss? The correct answer is toluene. Question 3. What is the current estimated percentage of adults who smoke in the US? The correct answer is about 13%. Question 4. Name 3 of the chemicals found in tobacco products. The correct answer is any 3 of the following listed earlier in the presentation, including formaldehyde, propylene glycol, cyanide, arsenic, plutonium-20, toluene, cadmium, and benzene.